Thanks very much for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. Tonight, between taboos, the effects of instability and crises, and the lack of resources and psychiatrists on the continent, Africa faces several challenges in offering support to those suffering from mental health disorders. However, many countries are starting to invest more in the issue. We take a closer look on Mental Health Day. Also, General Mahamat Idriss Déby Itno sworn in as president of Chad's second transitional government. The African Union, though, refuses to support the ceremony as it's against any extension of the transitional period. And attendees at the funeral of the 27 soldiers killed in a terror attack in the northern Burkina city of Gaskinde say that their grief is matched only by their frustration with the toppled government over deepening insecurity in the country. But first, Monday, 10th October marks World Mental Health Day. With the backing of the World Health Organization, the date is a chance to raise awareness about mental health issues around the world. Like many other regions, Africa has a large burden of mental health conditions. Many researchers believe that its suicide rate is likely underestimated, and even so stands higher than the global average at around 11 per 100,000 people. Mental health issues are often stigmatised and yet compounded by socioeconomic crises and a lack of treatment and resources. Sam Bradpeace brings us more on the drivers of this dilemma from Dakar.
Africa is home to 6 of the 10 countries with the highest suicide rates in the world. According to the World Health Organization, this is in large part due to underinvestment in mental health services. On average, it's thought that there's just one psychiatrist for every 500,000 people in Africa. And you have to remember that mental health services are largely concentrated in urban areas, meaning that the mental health crisis is generally worse in rural communities. Spending has increased over the years, but across the continent, it's still well below the WHO's target of $2 per person. Before the pandemic, it was estimated that there were more than 116 million Africans living with mental health conditions, although experts say that this number has likely risen, largely as a result of the economic fallout that followed COVID-19. In the lead up to World Mental Health Day, the WHO has announced that various programs covering different African countries from Zimbabwe all the way to Cape Verde to help governments better grapple with what is truly a global public health issue.
That overview there for us by Sam Bradpeace. Now, sometimes families struggle to cope, to look after or support members who need psychological or psychiatric support, and sufferers can end up being abandoned. Our correspondent in Togo spoke to one organisation that's trying to track down and treat mentally ill people living on the streets. This report by Emmanuel Soji.
In the Togolese district of Atiegu, near the capital, a homeless woman wanders the streets. Concerned locals reached out to these activists to ask them to help her.
How are you? What are you doing here in the sun?
The mental health workers try to find out as much as they can about the unknown woman. They would like to reunite her with her family, but spot many inconsistencies in her story. The organization, Hands from Above, treats cases like this as an emergency. Since last year, the 10 women removed from the streets had also previously been sexually assaulted, some been infected with the AIDS virus.
We try to reassure them so they understand that we do not want to harm them, but that we come here to help. Will you agree to go to hospital?
I must inform my husband.
In another neighborhood, Hands from Above is preparing to bring a 25-year-old patient back home to her mother. She underwent a year of medical treatment after her rescue from the streets.
The mother didn't even have a place to live. The association decided to finance her housing and a small business. This was to ensure she could look after her sick daughter after her release from hospital at home.
Before turning to hospitals, families affected by mental health concerns often first turn to holistic therapists or pastors at prayer centers. They often treat mental illnesses as supernatural events, but attitudes are slowly changing.
In recent years, some patients have been coming in and doing well, and their condition has stabilised. So now it encourages other people to come in for treatment as well.
It is difficult to obtain accurate statistics on mental illness in Togo. Most families keep the sick at home. At least 100 people suffering from serious mental health issues are believed to be living on the streets of the capital, Lomé.
Well, General Mahamat Idriss Déby Itno was sworn in as president of Chad's second transitional government on Monday. His father had ruled for more than 30 years before his death last April. Now, Déby's due to bring in democratic elections within 2 years, but the African Union refused to support Monday's ceremony as it is against any extension of the transitional period. Camille Nedlex talks us through.
The general, now president for the second time.
General Mahamat Idriss Déby Itno is appointed president of the transition, president of the republic, head of state.
The second phase of transition is expected to last 24 months. A forum charged with paving the way towards democratic elections has said at the end of that period, Déby could run for president. As leader, Déby has expanded powers and can directly choose his prime minister and his government, which he has promised to do soon.
The second phase of transition that we are embarking on will be fully devoted to the implementation of the conclusions of the National Inclusive and Sovereign Dialogue and the establishment of a government of national unity.
38-year-old Mahamat Idriss Déby took power after the death of his father, Idriss Déby Itno, last year. Idriss Déby was the country's leader for more than 30 years. As he took the reins, the younger Déby promised free and democratic elections at the end of an 18-month transitional period. But he also said he'd be following in his father's footsteps.
These values, so dear to our late president, will be honored and enshrined in the framework of an inclusive national dialogue that will be organized during this transitional period.
The ceremony was boycotted by most of Déby's political opponents. Representatives of the African Union were also absent after demanding an end to the transitional period and warning that no junta member should stand in elections.
Well, union officials in Tunisia have said that the country only has enough petrol for another week. The capital has seen days of long petrol queues. Critics of the government see the shortages as another sign of a crisis in public finances. But the energy minister said that a tanker is unloading fuel at Bizerte and has blamed shortages on Tunisians hoarding supplies. The fuel being unloaded could provide an extra few days of supply, taking it to about 10 to 14 days, down from the usual 60 days of strategic reserves usually held in the country. And a former Liberian rebel went on trial in Paris on Monday, charged with crimes against humanity and torture during the African nation civil war in the 90s. Kunti Kamara faces life in prison and has denied committing acts of brutality against civilians in Liberia's Lofa County in 1993 to 1994, whilst he was one of the leaders of the Ulimo armed group. Now, he was arrested near Paris in 2018 and he's on trial here because of a French law that recognises universal jurisdiction for certain crimes.
It's true that in terms of justice for Liberians, justice should be done in Liberia. But unfortunately, there is really no political will on the part of the Liberian government to create a tribunal to judge the crimes of these two civil wars. So in fact, other possible remedies are being used. And in fact, thanks to what is called the mechanism of universal jurisdiction, countries that are completely foreign to the facts can judge foreigners who have committed crimes abroad against foreigners.
Anger about mounting extremist violence in Burkina Faso has sparked 2 coups in the country in less than 8 months. Just days before the last takeover at the end of September, 37 people died in an attack on a humanitarian convoy in the northern city of Gaskinde. Thousands of mourners attended the funerals of the dozens of soldiers that were killed in the terror attack over the weekend. Our correspondents were there and sent this report.
27 portraits, for the 27 soldiers fallen in the Gaskinde attack in northern Burkina Faso late September. The youngest were just 23 years old, all buried together, side by side. The nation's grief is matched by its frustration over the former government's inability to protect its people.
We are in pain over what happened, with the loss of our sons and our little brothers. Because of insecurity, it's a great pain for us to witness this crowd.
But the military aren't the only ones on the front lines. Those they were supposed to protect, civilians driving the trucks carrying supplies to the besieged city of Déby, were also killed. The government estimates 10 civilian deaths, but the drivers' union believes that number is much higher. They paid their own tribute to the dozens of their colleagues still missing. This man survived the Gaskinde attack. He says he lost his truck, his friends, and a piece of himself that day.
We heard shooting. We took refuge under the vehicle, and we realised that they were starting to catch fire. We never found many of our colleagues. We do not know what happened to them. We can't even bury them properly.
The government has lost control of 40% of its territory, and incidents like the Gaskinde raid are all too common. The director of the drivers of the Sahel Union says every single convoy has faced some level of attack. Drivers say they've sworn to serve the communities that depend on these convoys for their survival, but they need more protection to keep on going.
Authorities must work with us drivers, because we know the field and the road towards Déby. We worked there even before the terrorists arrived.
Many drivers have already started repairing their trucks, determined to return to those dangerous roads.
That report there by Sophie Mahamat and our team in Burkina Faso. That is, though, all we have time for Eye in Africa. Thanks for joining us. Do so again. Take care.
In September 2002, on a regular weekly trip from Senegal's capital Dakar to Ziguinchor in Casamance, the Jula ferry capsizes under the weight of too many passengers.
Instead of taking 450 or 550 people, they took 2,000.
Of the 1,863 victims, only 450 bodies were recovered. 20 years later, justice has still not been served. Relatives of the victims are unable to mourn and move on. The ship is still lying under sea off the coast of Gambia.
I will never forgive. Justice must be done. People must be condemned and judged for their criminal acts.
Watch the Jula catastrophe revisited on France 24 and France24.com.
War has once more reared its head in Europe, recalling the darkest hours of our history.
Kiev is still about 30 kilometers away.
France 24 is providing constant coverage of events in Ukraine. Our teams on the ground and in the studio will keep you informed of all the latest developments. Stay informed, stay aware.
Liberté, égalité, actualité.